We don't have to tell you that the cost of health care is skyrocketing, especially for big companies providing coverage for thousands of workers. But there's a growing controversy about just how involved employers should get in the lives and personal information of those workers. Hampton Pearson explains.
The CVS drugstore chain, one of the nation's largest, is taking a hard line on weight control in the workplace, telling its 200,000 employees to participate in the company's health insurance, they must reveal health information, including weight, body fat, and blood pressure levels, or pay a $50 a month fine. That's $600 a year.
You said a $600 fine. Yeah, that seems pretty unreasonable.
The chief medical officer for the Rhode Island-based firm says it's not an invasion of privacy, but an incentive to improve employee health and reduce health care costs.
It's an incentive one way or the other. The way that we see it is that the company contributes a good deal to people's health insurance, and that people can get an additional contribution if they undertake this. Seems to make common sense to us.
Worker rights advocates say there's nothing really voluntary about asking workers to pay what could be a $600 a year penalty.
If you're looking at CVS, you're looking at a company that has a lot of low-wage workers, where $50 a month could make a significant difference.
A Kaiser Family Foundation survey finds 94% of large businesses now offer some kind of wellness program. Things like free health club memberships, nutrition counseling, even stop smoking campaigns. What's accelerating is the use of financial penalties to motivate behavior. Workers are adjusting.
If my job required it and I needed my job, yeah, I'd do it. I've got nothing to hide.
In a 2009 survey of 500 companies, 8% used financial penalties to motivate healthy behavior. Last year, that number jumped to 30%, according to Towers Watson, a risk management consulting firm. Healthcare experts also say draft regulations tied to implementing the Affordable Care Act increased dramatically financial incentives tied to wellness programs.
There really isn't anything else that the insurance industry or the employee benefits industry has shown that they can do to control healthcare costs.
CVS may be using what some might consider the stick approach tied to penalties. What's not yet apparent is how many firms will follow that trend. For Nightly Business Report, I'm Hampton Pearson in Washington.
We have two different points of view on this subject. Deborah Peel is the founder of Patients Privacy Rights Foundation, and Tracy Burns is the director of Northeast Human Resources Association. I'd like to ask both of you this question. We all want a healthier workforce. You know, how do we get there? Is it through rewards or is it through penalties? Deborah, why don't you start us off?
Well, penalties, of course, and these penalties in particular are very coercive. They're very hurtful. And most of the people that are working there are probably working a second job already. So it's cruel. It's cruel, and it's an insult to dignity. But worse than that, there are serious privacy problems. First of all, Americans have the right to health information privacy. The reason is this is very sensitive information, and it's been clear for decades that employers and insurers use this information to make decisions about hiring, firing, and promotion. So the privacy of health information and the lack of control of data in electronic systems and wellness programs require the collection of lots of sensitive data.
Let's get Tracy in on this conversation. Rewards or penalties, Tracy?
Well, I think it depends on the individual. I think, as you know, health risk assessments have been around since the 80s, so this is really nothing new. It's really just how it's being packaged. So it comes down to the individual and how they're motivated, and whether financial motivation works for some people and coercion or perceived coercion is going to work. It will be the proof in the pudding. I think like with a lot of wellness programs, it takes a long time for us to see the fruits of the labor, but I commend CVS for being willing to implement a wellness program because it's really not just about the bottom line, it's about overall well-being. And when we come to work, we don't just bring ourselves, our work selves, we bring our entire selves. And studies have proven that healthy employees equal productive employees.
Ms. Peel, I'm curious as to why you think that the practice of supplying or having to submit to a test where you would be weighed, have your body mass index measured, presumably your blood sugar taken and your cholesterol taken, is a cruel procedure. I believe that was your word. I'm not sure I understand why you perceive that to be cruel, and why, on the other hand, someone might not see that as, well, that's information that I could use, perhaps, if I didn't have it already, to live a more healthy lifestyle.
The cruelty is about the financial penalties that most people can't afford. The problem with the blood tests are, when you get blood tests, they're collected by a lab, data is collected about you, personal data about your body and mind. The public is very sensitive about this. They know that employers and insurers and wellness plans and labs and electronic data about health is not secure, and it's not private. They believe that these systems are not ready for prime time. They know that we have no data map of where all this data goes, who uses it, and what for. But it's very clear that this information is used to discriminate against people. The most important thing I'd like to say, though, about health plans is this month's Health Affairs did a very careful study, and they found that wellness programs basically don't work. They're one size fits all. These illnesses that we are having epidemics of are happening because not just of factors within the person, but there are social factors, cultural factors, and corporate factors as well, such as very addictive, terrible, cheap food.
All right, can we just get maybe a short explanation from you of what's the alternative? I mean, the status quo in our country right now is not working. We have an obesity epidemic, we have a heart disease epidemic, and we have a healthcare cost epidemic. So what do we do? Real quickly.
First of all, the alternatives are to find the solutions not only in the individual by working with individuals, but by looking at the larger factors in society. We don't have epidemics because suddenly a whole bunch of people in this nation are not responsible. These are complex problems. So we have to find the problems in the individuals, but in our culture, in our food chain, in our workplaces, to fix this, because wellness programs don't work.
Tracy, my employer requires me to submit that I haven't used tobacco products over the past year, or pay a penalty, and that feels like a reasonable, to me, a reasonable use of the expression of the employer's interest here. My question for you, though, is: are we going to a system where individuals' health care costs they'll pay more for insurance if they have certain personal attributes or certain behaviors or certain habits than somebody else? Variable pricing?
Well, potentially so, and it's not much different than what's been happening for quite some time with the incentive plans. So I think we have to be very careful about what we're penalizing people for and what's preventative. And a lot of the wellness programs that corporations have been involved in for quite some time are based on preventative measures and lifestyle things that you can change, things that are within your control.
All right, we're going to have to leave it there. This is obviously a topic that, as a country, we're going to continue to debate, and a conversation will be ongoing. Thank you both. Deborah Peel, founder of Patient Privacy Rights Foundation, and Tracy Burns, director of Northeast Human Resources Association.